Assalamu alaikum, I am Dr. Khadiza. Today I am going to discuss some clinical topics like anemia, polycythemia and jaundice. Firstly, what is anemia? It is a clinical condition characterized by pale coloration of skin and mucous membrane as a result of qualitative and quantitative deficiency of hemoglobin or red blood cell below the normal range of peripheral blood in respect of age and sex of the individual. Site of anemia examination: lower palpebral conjunctiva, dorsal surface of the tongue, skin of palm of the hand, skin of sole of the foot. Now the classification of anemia. Morphological classification according to red cell indices. First is macrocytic hypochromic anemia, that is MCV, MCH and MCSC are below normal. Its causes due to iron deficiency anemia, or it is the most common type, and thalassemia. Number 2, normocytic normochromic anemia. Here MCV, MCH and MCHC are within normal range and cause is blood loss or hemorrhagic anemia. Macrocytic anemia, that is MCV is above normal, that is cause are megaloblastic anemia and pernicious anemia. Now etiological classification according to the cause. Blood loss or hemorrhagic anemia, it occurs due to acute blood loss, chronic blood loss, due to bleeding peptic ulcer, hookworm infestation and menorrhagia. Impaired red cell production due to deficiency of essential nutrients like iron deficiency anemia, megaloblastic anemia due to vitamin B12 and folic acid deficiency. And number 2, bone marrow destruction, that is aplastic anemia. Now hemolytic anemia is another cause of anemia, etiological classification. Number 1, inherited defect in hemoglobin, that is thalassemia and sickle cell anemia. Number 2, abnormal shape of the RBC, that is membrane defect, hereditary spherocytosis. Now let us discuss about what is pernicious anemia. Anemia due to a failure of secretion of intrinsic factor of stomach, because of permanent atrophy of the gastric mucosal membrane resulting reduced absorption of vitamin B12 from the ileum is known as pernicious anemia. Now let us see how this anemia occurs in a flow chart. Lack of vitamin B12 and folic acid causes diminished DNA synthesis, and that's for that failure of nuclear maturation and cell division. So macrocyte in the peripheral in the blood, macrocytes the peripheral blood, so formation of RNA is greater than normal. Excess production of all the cell constituent including excess hemoglobin, so RBC become enlarged, that is megaloblast. Then for that megaloblastic anemia occurs. Now polycythemia, it is another clinical condition. In this condition RBC count become more than normal value in respect of age and sex. Type: absolute and relative polycythemia. Absolute polycythemia are primary or secondary idiopathic, and relative polycythemia are loss of blood fluid or reduced fluid intake. Pathological polycythemia, it occurs due to increased RBC count in response of low oxygen tension at high altitude, and blood count is about 6 to 8 million per cubic minute of blood. Now let us discuss about another clinical condition, that is jaundice. It is very important, we have to know detail about it. So definition: it is a clinical condition characterized by yellow discoloration of the sclera, skin and mucous membrane caused by an increased amount of bilirubin in the plasma and tissue fluid This normal value is about 0.3 to 1 milligram per dl of blood. So we have already know about the fate of RBC. From the fate of RBC, we have already known that how bilirubin is formed. It is actually formed from the extraction of the RBC, and then this bilirubin enters into the circulation as a unconjugated bilirubin, and it enters in the liver and form conjugated bilirubin, and from there it is secreted through the bile into the small intestine. From a small intestine, it usually excreted through the urine or stool. So any problem in this this pathway, the bilirubin level may increase. So this bilirubin may increase and may cause yellow coloration of skin and mucous membrane. So you can see this figure, a normal person in one side and jaundice person on another side. Normal person skin you can see in jaundice person skin is more yellow than normal skin. You can see the site. The site are usually sclera under surface of the tongue, palm of the hand, sole of the foot. Now let's classify jaundice. It can be classified as hemolytic or peripheral jaundice, hepatocellular jaundice, and obstructive or post-hepatic jaundice. Any prehepatic are usually the cause before enter into the liver, and hepatic cause are usually the cause in the liver, and post-hepatic are usually the cause after in the way from liver to the intestine. So you can see these figures how the pathway liver bile enters into the intestine. So let's discuss about hemolytic or peripheral jaundice. The pathology is occurring prior to the liver, and the causes are usually inherent defect in hemoglobin or abnormal shape of the hemoglobin abnormal shape of the RBC membrane. Now let us discuss about the classification. Now let us discuss about the hemolytic or peripheral jaundice. The pathology is occurring prior to the liver, and the causes are usually due to inherited defect in hemoglobin or abnormal shape of the RBC. Inherited defect of hemoglobin are thalassemia, sickle cell anemia, and abnormal shape of RBC are usually defect on the membrane of the RBC. These are usually hereditary spherocytosis or hereditary elliptocytosis. Hepatocellular or hepatic jaundice, the pathology is caused within the liver. The causes are hepatocellular disease like viral or drug induced hepatitis, cirrhosis of the liver, or alcoholic liver disease. Now last one, the obstructive or post-hepatic jaundice. The pathology is located after the conjugation of the bilirubin in the liver. The causes are obstruction at the intrahepatic or extrahepatic level, carcinoma of the pancreas, head of the pancreas or ampulla of the Vater, or extrahepatic bile duct. This figure shows the prehepatic, hepatic and posthepatic causes of jaundice. This is another figure how gallstone can obstruct the posthepatic jaundice. Here you can see the gallstone can obstruct the bile duct, common bile duct, or the cystic duct, or the ampulla of the Vater. Now let us differentiate the prehepatic, hepatic and posthepatic jaundice. Urine bilirubin increases more in prehepatic but less in hepatic, and absent in posthepatic jaundice. Urine bile salt is absent in prehepatic but present in hepatic and posthepatic jaundice. Urine bilirubin is absent in prehepatic but present in hepatic and posthepatic jaundice. Fecal urobilinogen increases in prehepatic, reduces in hepatic and also post-hepatic jaundice. Fecal fat absent in prehepatic but increase in other two cases, while liver function test is normal in prehepatic but impaired in hepatic and post-hepatic. Post-hepatic cases it may also normal. Plasma albumin, you can see it is normal in prehepatic but reduced in hepatic, and in post-hepatic case it may normal or reduce. Alkaline phosphatase is normal in prehepatic but high in hepatic and very high in post-hepatic cases. So students, that's all from me today. Thank you for watching.